my run working in the COVID testing site in Queen's Hospital during pandemic 2020. Suka duka dan pengalaman saya selama bekerja di Rumah Sakit Queens, New York sebagai pegawai tes COVID pandemic 2020.
Hi, this is Vimala from Infinity Meta. I'm just gonna rant about like my Christmas Eve for 2020. So today is the 24th of December 2020. I've been working in a COVID testing in like Queen's Hospital. I got the job through like recruiter or agency. So basically the hospital itself didn't care about us because they recruit us from the recruiter because their real employee doesn't want to do this job because they consider it super dangerous, like COVID testing is super dangerous, but it's just that dangerous and like deadly disease that people can just be cured just by staying home, social distance, wearing masks, and use your hand sanitizer. And this is the shitty things. I've been trying to I know I'm like fighting with this like myself. I just want to like rant because today, after I worked so hard for this entire 4 straight months, working like 12 hours a day from 7 a.m. to 7 p.m. non-stop, and like we got like 600 patients a day, and we basically they're milking us out, right? So today they called me stating that they're no longer using me because like a certain reasons, and they have to let me go. And they say they have to let me go because there's something like our conversation between me and the NP, or nurse practitioner, on the phone, and then like they asked me, what happened yesterday? I was like, well, yesterday what happened? You spoke to nurse practitioner, and I was like, I spoke to them every day. And I remember the NP asked me to cancel the visit. It's because they have symptoms, so they're gonna do antibody tests, right? And then that's it. Like, okay, you want me to cancel? Okay, sure. And then nothing else that we need to talk. And then we were so busy, so I just hung up, right? And the director asked me what happened, and then I didn't remember what happened because I met like more than like 100 people, and I didn't know. Well, you were on the phone, yes, and then he asked me to cancel stuff. Okay, what happened? And then I canceled. Okay, who hung up the phone first? And I was like, does it matter who hung up the phone first? And this is just so stupid. Like, they make this reason, and then they said like, because I refused patient to get tested because they were tested yesterday, the exact place, exact COVID testing site. And then it was me registering this person, and then this person like was unhappy because he saw the result for like, a positive COVID. So he's like, I want to retest. So means like he disrespect our test result, he disrespect our lab test. So he wants to test again. But why you have to be in the same place and the same COVID testing? So if he's not happy, he's supposed to go somewhere else. So I was just like, you know what, I cannot take you because I was trained to tell you to stay home for 14 days, for quarantine 14 days. And at least just like let it happen for a couple of days, and then you can come back, and then I can put you schedule. And then no, you have to do it every day. And how is this possible? This is violation for their own rules, right? Their own rules, like you're not supposed to walk around with a positive COVID result because they can pass it to people. But they're allowed to be in the line. They're allowed to like go everywhere, even they're sick. They're really sick, or no, because it's asymptomatic, and then they can like just walk around and then get retest, and then like, infecting everyone in the trailer. So this is really fucking shitty job anyway. So I'm so happy that I was like let go, and so I can move on with another thing. But this is really bullshit. Like Komodo homo is like really bad. Like it's just disgusting. Like the corruption that they do is just like disgusting and insane. I'm still in my scrubs. I just want to rant about my experience working in COVID testing in a Queen's Hospital in New York. I've been working for 4 months non-stop. I worked 12 hours a day, and like 4 or 5 days a week, with like I met like more than 100 patients a day, because we met like 600-700 people, and then we're like only like a 6 people working, and like 2 of my coworkers like kind of like ass kissers. They didn't really work, they always disappear. I didn't care about it. I don't want to be in that drama. But today, December 24, 2020, which is Christmas Eve, they called me after my shift. They asked me to finish my shift first, and then they called me, and then they said they have to let me go because I did something wrong. And I was like, what's something wrong? Oh, you spoke with the NP yesterday on the phone, and then you hung up first. And I was like, does it matter who hung up first? Because it was just the NP asked me to do something, and there's nothing to talk about. I was just, okay, I'll do what you want. I'm just like, I'm the registrar. So I was doing like whatever the NP did, and then it's just a bullshit. Like, hey, can you do that? Okay, sure, right? And then I hung up, and then it does matter. And then apparently the NP like report that I was like maybe like slammed the phone or something, and I did not at all. And then they said like I was like doing racist just because I asked the way I asked for the insurance card. Like, instead of asking do you have insurance card, but the way I asked is like, you don't have insurance? So it's like matter. They said that I was like really racist to African American people. And then like, as I know, like everyone likes me, like they're all the patients, like they remember my name, like everyone's showing like a care. So I mean, I know this is just like a bullshit, like someone's like snitching about things that untrue, and I didn't give a fuck about it. It's just like a shitty coworker that's always disappear, not doing the job. And then they said that I refuse some patients who are like tested positive COVID like yesterday. So they tested yesterday, and then they got tested positive, right? The same place I was registering them, and then they got positive, and they were not happy with the results. So they came back today. They want to retest. First of all, you disrespect our lab tests, right? Because means that you're not happy why you want to get retested here. Why don't you just retest another place like CityMD or somewhere? That number one. And number two, this is like breaking our own rules, right? The rule is like, if you tested positive, you're supposed to stay home for quarantine 14 days or whatever, 10 days, whatever, because the COVID testers like always change their words after like sometimes like 3 days, sometimes 5 days, sometimes 7 days, and 10 days, and 14 days, whatever the hell they want, right? And then like if you are allowed to walk around passing the deadly disease like COVID testing virus bullshit, this is not really deadly virus then, because you just like simply can wear mask, hand sanitizer, social distance, and then just get rest at home. Not even 14 days, 1 day, and then you can come back and then get retest. And I found out it's actually like this bullshit. Why they're doing this? Why they're like, catching the number, like how many patients that you test per every day, because it's the fucking money. I heard, this is from like, trusted sources, that they got like $800 per person if they got, if they test people. And like the Como, the fucking clown Como, maybe got money from the Fed, or I'm not sure, but that's what I heard. But I'm like fired with the dignity and honor. I don't give a fuck, because I feel so stupid when I'm like giving people the understanding, oh, you have to do this, you have to stay home, blah 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 blah, and then, oh no, that's okay, you can get tested the next day, the very next day. And then I got fired for that because like suggesting people to wait a couple days. No, fuck that bullshit. I hope that you guys understand this. It's like if this job is a shittiest job, they didn't get paid well. If this is really risky job, they pay us really bad, like worse than labor, because this kind of like risky job, and then they don't even have like they violate everything, the HIPAA, and then everyone can swarm right behind you, next to your head, and then like speaking next to you, and then they don't even have PPE, and then they have to open their mask, and I have to take their photo, their face, full face, and I have to ask them to put the mask off even they're tested positive, and then they only gave me like regular mask or like N95 or whatever. But who cares if it's really deadly? They didn't even put screen on us. It's like they're sitting next to us. I can even like smell their breath. It's just that bad, And they violate all the HIPAA. They didn't let people, reading what they sign. There's so many violation, and so many patients like knows about this, and we cannot do anything because like nobody really like reporting this, and because nobody really care. And so I'm just like glad that I'm like out of this bullshit job, like. And then they said there's another like a new virus, and then like the most important thing is like I finally can get out of the mandatory vaccine, I guess. Maybe it's not really mandatory, but like I'm a frontline worker. I deal directly with them, like physically as a first person. And then, they don't need, it's not even clinical. I'm not even a clinical worker, but I have to deal with them. I have to like face them like a physically the first person. I have to screen them basically before I send it to the NP. Right? And then I have to do this like a COVID vaccine shit that I never get sick for like 11 years, never. And I know myself, I'm a very healthy person. Like all of this like a vaccine and such, it's not gonna do anything to me, and I have a right to decline it. But seems like they give me like a hard time, because last time I declined to have like flu shot, they gave me hard time, like on top of all of those like accusation that untrue. So yeah, I know, and I'm like aware that I deserve way better job because I have skills. I at least I have dignity and honor for all of these things. Like I'm not gonna like swallow my own like saliva after I said something, especially to some patients. I was not trained to do anything. I was just trained to say like 14 days, and then I of course I have to suggest them you cannot get tested again, at least like couple days, not like yesterday tested and then today the result coming like a positive and then I let you like retest. That's so fucking stupid. And then why they let it happen? Because one is the money, and where's the money from? Is the Fed. And what is that? Federal Reserve is the Illuminati. Yeah, I said Illuminati. And it's for the one world order bullshit, So you can go fuck yourself, Illuminati. I don't give a fuck, Like I'm nobody anyway. So I'm just gonna run this thing, like at least for my peace of mind. I don't care. You can wish me like bad or anything. I don't care. Like a karma will catch anyway. They will find a way to balance, what you deserve. So I'm just like doing thing or do the job that I think is like ethical and not stupid. If it's this is really deadly disease, that you're not gonna face it with like just a mask, like just a fabric mask, then hand sanitizer, social distance, and then stay the hell home. That's like basically way easier than flu then, right? Because the flu at least like 2 weeks, right? Flu. And I don't know, this hand sanitizer thing, social distancing is bullshit. It's complete bullshit. I hope you understand. Stay safe, okay? Stay healthy. Bye.